Yeah, there we are. Brilliant. Well, here I am. So lovely picture of me and my role as a senior knee surgeon and one of the heads of knee surgery at the Schoen Clinic. And I'm really just going to use my experience as a surgeon just to talk about the injuries that do occur in skiing, and I see frequently around the ski season. And maybe things that we can do to stop them from happening is also valuable. As Ed was saying, I practice out of the Schoen Clinic, who are a German group who set up this rather lovely clinic in Wigmore Street. And it's one of the great privileges in life doing my job, because I get to see people who are injured and help them. Some of the time it involves me as a surgeon, but a lot of the time it doesn't. It's me just working in partnership with my physiotherapy colleagues. And actually, a lot of the time, these injuries can be treated without the likes of me getting involved. Generally speaking, let me assure you, you want to keep well away from surgeons. That's my first piece of advice. However, if you do end up needing surgery, make sure you go to a hospital or a specialist who does a lot of whatever it is you need, and also measures their outcomes and is able to tell you what their results are. So look, why am I giving you this talk? Well, very simple, because I think that if knowledge is power, I think patients, and particularly people who take the trouble to log on to webinars like this, are people who have a genuine interest in health. And I do webinars on all sorts of things. I have the privilege of looking after a lot of sports people. Some are elite, some are not, some are weekend warriors, and some just are occasional sports people. But everyone, has an interest in making sure they don't get injured. And I think, therefore, a little bit of an understanding about not only ideally how to prevent injury, but ideally what to do if you get injured, I think is valuable. So this is a chap I think you'll all be familiar with, the lovely Mr. Macron, and he has actually now prevented me from skiing for 2 years in a row. And recently, last weekend, I had a ski trip, so I'm particularly bitter and twisted, as he lifted the ban pretty much just as I was due to head off. So thank you, Mr. Macron. That's a little bit late. And luckily, I have another trip onto the slope. So I do practice what I preach, and I'm out there, hopefully, with the rest of you, enjoying this year's snow. So the big course, or the question is skiing madness? I mean, we're all mad to be out there skiing. Well, no, we're not. It's overhyped. The injuries that happen, we tend to hear about them a lot. Everyone talks about them. And actually, obviously, there are two types of injuries. There's the terrible ones where people are killed, the tragedies, and there are the injuries. Dealing with the tragedies, about 58 British deaths occurred between 2012 and 2016. They're the only figures I've got. And that seems quite a lot. But when we put that in context, actually, it's not as bad as you may think it is. So the answer is, and equally, the US stats were around 54 fatalities out of about 51 million people who ski or snowboard. So the reality is, it's about 1 fatality per million skier days. And if you really want to know what that means in real life, the truth is, if you ski 2,700 years every year for a week, there will be a fatality. So it's extraordinarily rare. And so the answer is, you don't have to worry too much about that. What you do have to worry about is the possibility of injuring yourself. And if we look at the injuries, the sort of injuries that occur, predominantly lower limb, and we'll talk about the upper limb injuries in a moment, and of which predominantly those are knee injuries. We talk about those injuries occurring about once every X injuries per 1,000 ski days. And they tend to be about 2.5 to 3 injuries per 1,000 ski days in total, all the injuries. And that's really saying if you ski, maybe 20 days, you're lucky enough to ski 20 days a year, you would injure yourself once every 16 or 17 years, which is actually about right. Most of us who are keen skiers might have an injury once in one your skiing career, a serious injury. Again, let's look at those injuries by breakdown. There's about 35% from the knee injuries and 20% are lower leg, ankle and foot. And of course, the upper limb injuries we'll cover in a second. But actually, if you look at the distribution of male and female, there's slightly more on the national statistics, men than women. I don't think that represents my practice, but it's certainly a figure, and of which the distribution is between children and teenagers, and of course is a second spike in middle age, and we'll talk about that in a second as well. In my practice, I see an awful lot more women than men, 3 times more women than men, and although the carving skis have improved the injury profile by reducing that length of ski, most injuries happen as a result of forward twists. Probably the women factor is to do with laxity. If you have lax joints, you're much more vulnerable. And of course, we all know that those bindings, because women are lighter, don't often release as quickly with women as they do with men, and therefore the foot gets stuck in that binding, and therefore that twisting injury happens that we all know about. The injuries tend to be often knee injuries where you get your ski, you're bent down, you're turning, the knee gets caught, the foot gets caught in the snow with your ski, and you tend to have a sharp inward turn of your ski tip inwards. And unfortunately, that goes all the way up to cause trouble in terms of the rotation on your ligaments around the knee. And the ligaments that get damaged are the inner or MCL or medial collateral ligament, strap ligament on the inside, and there's 3 grades of that sort of sprain, which just hurts, then a little bit of a tear, and then a full tear, and they're called 1, 2, 3. And of course, the really big injury I see most of, to be honest with you, is the anterior cruciate ligament, which is the ligament in the middle of the knee. So the anterior cruciate ligament, which is one of those ligaments in the middle of the knee that sits and stabilizes the knee, that is a really important ligament, and that gets popped or damaged during that twisting injury, and people often hear that. I won't go into great detail about how it happens, but suffice to say, your foot gets dug in, you carry on going forward, your leg goes out, and unfortunately that twisting injury is just too much for the knee, and the ligaments, both the collateral ligaments, that strap ligament, and the inside ligament damage. Or jumping is another common one, or you're going into hyperflexion. Jumping is really very dangerous, and I would really advocate against that. We see a disproportionate number of injuries from that. If you injure your cruciate ligament when you're skiing, obviously you get taken down the slopes. Most people cannot ski on with that injury. I've seen a couple of exceptions. You certainly can travel, and anyone who says to you that you terribly important have to have an operation there and then, it's just not true. There's plenty of time to let the dust settle and assess the situation when you come back. And what we tend to do is give you some blood thinners, put you on the plane. When you come back, you can get a proper scan. We can see exactly the nature of the injury and what we can do to help you. And sometimes it doesn't need anything other than just rehabilitation with good quality physiotherapy, build up the muscles. Plenty of people can get by without surgery, I can assure you. Really, it depends on your age, it depends on your experience, it depends on how much you ski, but surgery has to be earned. The key thing is it's not automatic, and the conservative options of not operating and maybe using a brace such as the Don Joy brace when you're playing other sports for someone in their middle age is very real. Physiotherapy really forms the backbone of this treatment, and in my opinion, frankly, I think that I tend to recommend that to people unless people are young, much younger, and are going to play other sports such as football or twisting and turning sports. I think that, as I've said, it is becoming increasingly popular, even still skiing. Once they let us back on the slopes, get fit, get those muscles working, do some prehabilitation before you go out there. If your muscles are firing, they will protect you. And frankly, as you're not going to get killed anymore than you're going to get killed on the car on the way to the airport. And let's be honest, in terms of injury rates, skiing is no more dangerous than football. I must confess, middle-aged women are the ones who are most vulnerable, probably need to do the most homework and think a lot about their rehabilitation or prehabilitation before they go. Knee injuries are the most common injuries that we see after skiing, and that, frankly, there's no rush to treat them. Don't let anyone bully you into having an operation or treatment elsewhere. Just take your time, contact us or anyone who you advise, your physios, and they will advise you what to do when you come back. And be honest with you, as I said, not treating people with surgery is a very real option that I would always give serious consideration to. And in fact, I'd go so far as to say I'd always actively encourage that view. I think that the real thing that you need to do is to make sure that you have access to good quality medical care, both when you're there and on return. Don't take any rash decisions, and really do a bit of cycling before, do some training, do some running, and get the muscles firing up, and do all those classical ski injuries. They do help and they do make a difference. If you're really worried about your laxity, then you can consider even using braces without having had an injury as prophylaxis. I hope that helps. It's very brief, but I said I'd try and stick to 10 minutes, and hopefully I have. Thank you.
Good evening, everyone. Thanks for tuning in. Thank you, David, for kicking things off nicely there. A warm welcome to our outstanding consultants from Schoen Clinic. It's a privilege to be talking beside them tonight. To then introduce myself, my name is Debbie McEvoy. I'm a senior physiotherapist based at Sports Clinic in the city at Bank. We do have another 2 clinics. So there's one based at Liverpool Street in the city and one up in Hampstead Heath. All clinics come with a multidisciplinary team. So essentially what that means is there's a whole varied mix of us healthcare professionals. So it's not just physios, we've got osteopath, chiropractor, rehab specialist, massage therapist, so a good varied mixed team to cater for your needs. So, you know, if you do need any advice, we are here to help. Okay, so we, a lot of us, not all of us, but a lot of us tend to hit the slopes thinking we're the king or queen of the slopes, but sadly we can end up like this, in a bit of a collision or on our backs or other positions, but essentially no wonder we tend to get injured in this sport. Now for tonight's talk, I'm going to be focusing on the lower limb, following on from David. So, and the reason why, I think my slide is working, we'll give it a second. Maybe I'll try again. Here we go. And the reason why, as David nicely touched on, so just to kind of briefly reiterate this, is that the knee is the most common site of injury. So the percentage has kind of differed a wee bit from the stats that David pulled out, but essentially the message is the same here. So just kind of be careful what you do read out. There's a lot of mixed messages on podcasts, you know, internet. These are evidence-based stats, you know, and more specifically, I'm going to be focusing on the ACL, anterior cruciate ligament, which is one of the main stabilizing ligaments of the knee. So again, David nicely sort of illustrated and went through this. So just as a bit of a brief overview, the knee has a lot of stabilizing structures. It has 4 stabilizing main stabilizing ligaments. The ACL being one of them that we're talking about. We have the medial collateral on the inside, we have the lateral on the outside, and we have the posterior on the inside as well. And as you can see, the ACL, it connects from the femur, the thigh bone, to the tibia, the shin bone. That's just the highlighted picture as well. So the function of it, just briefly, it just prevents the tibia, the shin, sliding forwards, you know, relative to the femur, to the thigh bone. And in terms of the mechanism of injury, if you like, so that happens plus the sharp kind of downward rotation as well. And just a couple of examples when we're on the slopes, you know, how that can look. So what happens here is the inner edge of the ski catches the snow, and then again that knee is forced into that downward rotation, and then that's where we can injure our ACL. And in this position as well, sometimes we can injure that medial collateral, that ligament on the inside of the knee, and sometimes around the cartilage as well, but predominantly the ACL. And you've got another way of injuring here as well. So when you are landing from a big jump, you know, and a lot of force goes through the heels, and again, you've just got that excessive force, that sliding forwards of the shin bone, the tibia. So things to consider, you know, when hitting the slopes, ski boots are uncomfortable, but really, really important. So just to quote, you can see here the inappropriate failure of the binding. So essentially, it's one of the main causes of skiing-related lower limb injuries, you know. So really important to check the quality of your kit, your boots. So boots have came a long way in terms of, you know, they offer a lot more rigidity and stiffness, great for ankle stability, but you want to ensure that those bindings release easily, right? So if you over tighten your bindings and you're going for it down the slope, you know, you catch something, you know, those bindings don't release, then you're in for trouble. So really important to be mindful of that. And other things as well, another couple of messages here is getting strong, you know, doing the right rehab. So I think in skiing, and I'm not saying this is everyone, but a lot of people, I don't really hear a lot of people pre-training for skiing as such. It's just like pack the bags and go and hit the slopes, you know. So it's not like if you're training for a marathon, you know, you have people running for months or doing their strength training, fab, but I don't really hear it in skiing a lot. So just being mindful of those kind of things, really getting yourself conditioned to hit the slopes. Correct equipment, we've touched on the boots there already, the bindings, the loosening of the bindings, really important. And you know, again, if we are going on a jolly, maybe we're a wee bit hungover, a bit tired, just easing into it, you know, not going full pelt, and straight away a nice warm up before you get down the slopes. So this is probably what you all came for. I thought I'd share a few little snippets in terms of exercise ideas. Now, these handful of exercises, these can be useful in conditioning, a little bit of strength and conditioning before hitting the slopes, and actually as part of a rehab plan as well, obviously with guidance of a physiotherapist and depending on what's going on and what we need to tailor to your needs. But this is just giving you a bit of an idea. Now, if you would like any more advice or exercise ideas, just feel free to ping me an email. Be more than happy to help. But just to give you a bit of an idea what we're looking at here. So the first one, here's a little video of predominantly working the thigh muscles here, the quads, really important in skiing. So as you can see, we're into a wall squat position. We're getting a bit of resistance working in the way to work the inner thighs and a bit of resistance pushing out the way to work the outer thighs and getting the glutes involved as well. All right, so here we are. So same position, wall squat position, fine. We're still getting in that resistance band in there to get the glutes and the hip involved. And then we're just starting to challenge the stability around the knee a little bit more with reaching out with that other leg. So a nice way to kind of start a little bit of progression there. And then, yeah, so same sort of wall squat position, a bit of resistance. We're on a balance pad. So again, we're challenging the knee a little bit more in terms of that stability and doing a little bit of reaching out. So it's just kind of ramping things up a little bit more there. All right. So moving on from that, next body part we can sort of focus on is a little bit around the core, stomach muscles, trunk muscles, a bit of hips as well. So, you're probably all familiar with the plank, right? We can add in some leg extensions just to work the glutes and the hips a wee bit more, fine. If we are happy with that, then what I've done here is I've added in a wee bit more resistance. So I've just tied it around my feet. So I'm driving my knees up towards the chest. I can do it sort of linear, like up towards the chest, so I can rotate the leg out a little bit just to challenge things a little bit more. Let's stop that video. We'll just ignore that and focus on the last one here. So, and then we can turn it into something a bit more dynamic, leaving the resistance in, turning it into a little bit of a crawl, adding in a little bit of leg and hip and glute work there as well. Really nice to challenge the core and the hip flexors a little bit more. Great. So, moving on from that, just a last little set of exercises here, really important. Really working on that single leg control here as well. Great for that rotational stability around the knee. So we've got a little bit of a sit to stand single leg squat going on with added resistance to get the glutes involved and added weight there as well with a little bit more loads. So this one is really nicely adding in a bit more resistance. You see it's coming in from the side here. So I'm having to really control that position, that single leg squat with that added lateral resistance as well. So things are starting to work a wee bit harder there. Okay, and then if we want to ramp it up a little bit more, finally, same sort of thing, but we've got a lot going on here. We've got the single leg squat, we've got the added resistance, we've got the resistance coming in from the side to challenge that rotational stability a wee bit more, and then we've got the reaching out as well with the other leg. So that means really, really getting worked there. All right, we've got there on the end of those videos. Thanks for holding tight. So, bottom line is, we don't want anyone to injure themselves, but if you do injure yourself, should you see a physio? Short answer, yes, we are here to help. Okay, so just some top tips when you're on the slopes. If you are in a position where you do injure yourself, you've heard of the old expressions like RICE, rest, ice, compression, elevation, then that got changed to price, and then they have police. Now it's peace and love. So these are the current evidence-based guidelines. Now take these with a pinch of salt. It's just sort of guidelines to follow briefly if you are in that situation. A nice little handy tip if you're there, you're surrounded with ice and snow, right? Getting a wee Ziploc bag out, filling it with snow, popping it on your knee. And if something just doesn't feel right, you've injured your knee, it's not feeling great, please do seek medical attention. As I say, we are here to help, and we've got excellent connections with our consultants at Schoen Clinic. Even if you see physio first, consultant first, doesn't matter, we're all there to help you and get back on track. And finally, to brace or not to brace. So, great question. Don Joy have a great supply and variety of braces. These are just some examples of ACL braces, and essentially it's down to your physio and your consultant to decide on what's right for you and to fit it for you as well. That's really important. And these come into play really if you have a pre-existing injury, right? If something's still a wee bit weak or unstable, we can put one of these on, or if you're recovering from surgery. And that's me. So thank you for listening.
Here's a picture of me. I'm one of the upper limb consultant surgeons over at the Schoen Clinic, working with David. There we go, it's moving. That's actually the artwork on the wall of my room. So it always reminds me that skiers are always around the corner, particularly around this time. And apart from working with our team at Ultra Sports, so if I have access to them, you have access to them as well. So you will have a full team for assessment, not only from physiotherapists, but specialists as well, which I work closely with, and that can be in any part of the limb. The knees being covered by David, and as I said, I'm an upper limb surgeon, but I don't work on my own. So I also have access to my own little team of specialists over the Schoen Clinic. So there are 3 of us primarily who work in the upper limb, and we share work. So not only do we discuss maybe more complicated cases and even see them, so you have an opinion from more than one surgeon, but on occasions, even complex surgeries are performed by just more than one surgeon. So again, you will have the full complement of expert surgeons who will need to treat your injuries expertly. So as David mentioned initially, the Schoen Clinic has really championed what we call patient-reported outcome measures. So that is to let not only us know, but also our patients know that what we do well. And we learn from that. So they are collected continuously, and we learn from that data. And we're happy to share them to show that we are good at what we do. So there are over 200 million skiers worldwide now. Hurtling at speed can cause injuries in any part of the body. But as our lower limb team mentioned, Debbie and David, that lower limb injuries tend to predominate when skiing. But more recently, snowboarding has become much more popular, and more people are snowboarding. And upper limb injuries predominate in the snowboarders, just because your feet are really tethered in the snowboard. So you tend to fall down a lot because you don't have use of your feet to steady yourself, and you fall down on your bottom or really on an outstretched hand quite a lot, and that can lead to injuries. Saying that though, David quite rightly said that the rate of injuries these days have decreased a lot from about 50 years ago, where you had approximately 8 injuries per 1,000 skier days, which is how they measured them, to something around just 2 these days. So 2 injuries. So it is decreasing. And here's a chart to show that lower limb injuries tend to predominate in skiers, whereas snowboarders mostly have upper limb injuries instead. And as I said, that's because they put an outstretched hand in front of them to really protect their fall. And falling down and learning to fall down properly is actually a tip. And that's something that's taught not only in the snowboard school or ski school, but can be taught here as well. So that's upper limb. And then the common injuries I wanted to mention today were these 3. There are many injuries that can happen, but the top one is a giveaway for a topic. It's actually got skiers as the name, skier's thumb. And I think Glenn will go over this in detail as well, but I wanted to give you what it entails from a surgeon's point of view and why it's important to be properly assessed and even to get proper investigation or imaging to really tell you whether your surgery needs surgery or it can be treated in what we call non-operatively. And sometimes it's very subtle and it's not something that you can tell very easily just by looking at the thumb or even just examining the thumb. So this is actually my group or my gang when I go skiing. I'm fairly new at skiing. I've only skied the last 3 years. And what can you do to prevent an injury? Well, we are all very different. Some of us are pretty expert and have been going since they were children. And some like me have been fairly new at it. So I've only just passed the blue runs and then into the red runs now, really. But training is important. So not only with respect to getting yourself conditioned, getting your muscles stronger, and what we call prehab, but actually training in the endeavor you want to take part in. So if you are a novice skier, I don't ski many times a year. I probably go once or twice, but I think I'll be better if I go more often. So I actually do a ski lesson before I go skiing, just to remind myself of what I can do, what my limits are, and what I can do. And they offer ski schools while you're out there as well. So you may be able to incorporate a day or two of skiing training. And I've had friends who have had off-piste training because that's something that they wanted to do. And that's not readily taught on your day-to-day skiing lesson. Know your limits. So there is a safety aspect of it. Of course, you are hurtling down a slope at speed. So being intoxicated, let's say, is not the best idea when you're doing that. Although obviously a little bit does help and keeps your courage up. So the simplest example I give you, and it is a simple tip which does work, is to do with a skier's thumb. So a skier's thumb is caused by a twisting effect on a thumb, and it basically injures the ligament on one side. And how that's done is when you fall down, and you fall down on the handle of the grip, and on top of that, the strap around your wrist twists around your thumb at the same time. Glenn, I think, has a perfect picture of this. And it shows you the correct way of holding a grip, and that is putting the straps inside your grip and not over your thumb, because as shown later, that causes this injury. So a simple X-ray can show this injury, but sometimes, and more usually, it's actually more subtle. So you can see that flake of bone with a yellow arrow pointing at it. That's a more obvious injury where the ligament pulls off a bit of bone as it tries to rip off. So this is not a ligament injury. It acts like a ligament injury, but it's actually a small fracture. It does actually heal very well. It's the ligament injury that is more difficult to treat for the upcoming reason. So that's the ligament on the right that snaps, what we call the ulnar collateral ligament. And it causes your thumb to bend away from the rest of your hand because there's no restraint there. And special imaging shows what's going on here. It has snapped, but this is the specialist view that you want to see. And that is the ligament has not only snapped, but it's now stuck on either side of a tendon, what we call a stena lesion. So it's very important to identify that, because the ligament injury by itself that is on the same side of the tendon is likely to heal. So you could treat this what we call non-operatively, but without careful examination, identifying that that's where the injury is, and then getting specialist investigations like an MRI scan, you would not spot that, and you may treat it non-operatively, but it's unlikely to heal if that's the case. So this needs to be identified. If it is identified, then it's surgery, I'm afraid, and we can repair your ligament and reinforce it with a graft, and then reinforce that further with what we call anchors, which is the blue and white strip that you can see there, which is tethered into bone, and will fix the ligament and reinforce it such that your x-ray might look like that on the left before the injury, but after the repair, it's nice and straight again. And after a period of time and rehabilitation and therapy, you should have a well-functioning normal hand with a good grip. Of course, if there isn't that stena lesion, you can just treat this in a thermoplastic splint and it will heal without any surgery. So not everything needs surgery. Other injuries of the wrist, let's say, snowboarding, as I said, it's common injury, will be obvious. So this kind of injury, I think most people here will spot that that bone is really out of place. But not all wrist injuries, some need surgery, and sometimes a plaster cast for a few weeks will suffice. And they now make lightweight splints that you can wear, which can also be waterproof. And again, that will immobilize it in place and surgery is not needed. For that particular fracture that we just saw, it was very much out of place and does need a metal plate and screws to hold it into a perfect position again. But the advantage is you are able to move your wrist pretty much straight away as soon as the pain settles following surgery. Talking about shoulder injuries, there are several injuries that can be sustained. That's all highlighted. Those common ones are in blue. The anterior dislocation is the subject Glenn and I are talking about. The shoulder is an inherently unstable joint. It's basically a ball on a saucer rather than a ball in a socket. So it's all the muscles and ligaments around it that really hold it steady in place, centered in the little saucer that it's lying on. So this last slide shows you the shoulder. You can see that the ball of the shoulder is out of place. The socket is here. The ball is here. So it is a dislocation. There are no fractures, nothing's broken, but it's just out of joint. So the patient, when they come to you, will come with an abnormally shaped shoulder. It's squared off, whereas on the normal side, it's nice and rounded because the ball still rests on the socket on that side. The real emergency here really is putting it back into place, which should be done wherever you are, be it in the UK or abroad in the, on the slopes. And that's really the only emergency procedure that's needed right there and then. Any further investigations or definitive procedure, if needed, can wait until you come back to the UK. So exactly like David and Debbie said, most of the time, operations or rehab can be performed once you return back home again. So that was just a taste of some of the injuries that can be sustained in the upper limb. I'm sure there'll be more in the Q&A section where I can be a little bit more specific. I pass you on to Glenn now, who will talk to you more about the physio side of upper limb.
Okay, so thank you very much, everyone, for still staying tuned here to listen to the very end of the chat with me. But thank you very much to David, Adrian, and to Debbie for your explanations. That was great. So, introduction to me. So, my name is Glenn Etherington. I'm another senior physiotherapist at Ultra Sports Clinic, based in the Bank location with Debbie as well. There's my email and the office telephone number if you do need to get hold of us. So today I'm talking about upper limb injuries, following on from Adrian's chat there. I'm focusing on skiers' thumb and shoulder injuries. So, well, thumb injuries and shoulder injuries, I should say, because it's not primarily skiers that can get that injury in the thumb. It can also be achieved just by falling on the outstretched hand and that thumb being pushed back. So snowboarders, beware, you can actually be injured from this too, especially if you're holding onto your GoPro stick or you're holding onto a drink or something else. So the mechanism, I know we've kind of briefly gone over that, but it's an injury to that ligament on the outside of your thumb when you fall down with an outstretched hand normally, secondary to that kind of fall. Alternatively, this can occur when you're driving, so holding onto the steering wheel, having a little bit of a shunt, and then that forcing the thumb backwards. So it's not just on the slopes that you can get this kind of injury. Even tripping over down the street, you can actually sustain this kind of thing. Now, although we've got a couple of techniques here to assist and hopefully take away that that case of you falling with your pole in your hand, there are some evidence and some studies out there that suggest that even having a strapless pole, so even having a pole that doesn't have a strap that you hook your hand around in, doesn't necessarily take that risk away. Having said that, so here's the slide that Adrian kind of showed you earlier on. So just how to effectively try and put that pole around your wrist to try and eliminate that kind of pulling on the thumb on that ligament. So it might be worth having a screenshot of that. If not, we are actually recording this, so if anybody wants to go over this at the end, you have access to that. So skier's thumb, have you done this and how are you going to know if you've done it? Now, normally you would find extreme pain trying to grip anything. So holding onto a water bottle might be really painful, holding onto a ski pole, trying to open up your hand to place into your glove would be painful. And, you know, what should you do? Now, Debbie's already touched on kind of, you know, the peace and love and placing ice on the area to try and make that, you know, decrease the amount of pain that you've got and possibly some inflammation. Now, you can get some really good splints, and Adrian did spot on that as well, and you've got one here on the left-hand side, a real fixed splint. But also what you can do, and I'd always advise anyone to take some tape with them away when they ski or on any trip, to be honest. You can get some rigid tape. Now, it's normally called a zinc oxide tape, normally only a couple of pounds. But as you can see here on the right-hand side, there's a really nice image of how you can actually strap your thumb up to make it nice and supported. So if you have fallen over and you're getting that pain down at the base of your thumb, sometimes feeling like it's around the wrist, get some tape there, wrap it around, and that should keep you with a nice solid wrist and thumb for the rest of the holiday. Now, obviously, it would be great if you could go and seek some medical advice. Hopefully you have the insurance. So if it's really, really bad, then please do that. But as everyone's kind of touched on, there aren't many things that would prevent you from just waiting until you came back to see us. So that would be my advice on that. Now, in terms of prehab, I'm going to talk more about that on the shoulder. With this, it's very, very difficult. Obviously, there's grip things that you can do, you know, holding onto a ball and gripping to increase your grip strength and helping with the extension of your fingers and your wrist as well. But actually doing any kind of rehab to try and prevent this, unfortunately, isn't going to happen. So it's just trying to steer clear of that injury if we possibly can. Now, moving on to shoulder injuries, there are three quite nice pictures here, I think, really, that can give you three different ways in which you could injure your shoulder whilst you are away. Now, again, this isn't just skiers. Apologies, snowboarders, if you've tuned in. I've only chosen skiers on these pictures. I should have been a bit more astute with that. But some really nice pictures here of an internal rotation injury, and that's the top left-hand picture you've got here. You've got a real outstretched external rotation injury here on the bottom left, which puts the force on the front of the shoulder. And a more subdued fall, possibly after a couple of pints at lunchtime or a couple of tipples, which would force that force the pressure upwards into your shoulder. Now, what we'd like to try and do, and the kind of the reason for this talk, is to try and promote the prehabilitation and the strengthening of those structures and the muscles around the shoulder to help prevent that from happening. Now, the reason I've got this slide up here, so as Adrian touched on, a ball and a saucer and a ball. So I like to think of it as a cup and saucer. They're quite unstable on top of each other, aren't they? A ball and socket is really nice and rigid, like you would have in your hip, but in your shoulder, that's not necessarily the case. Well, it's not the case at all. So all of these structures that you can see in front of you here, all of these muscles, you can see on the picture on the left-hand side there, it's pointing out the part of the rotator cuff muscle. And then on the right-hand side, you've got all of those other structures and all of the other muscles that are going to help actually move your scapulars, so your shoulder blades, and help with that humeroscapular rhythm, which is basically when how your shoulder moves. So your scapula has to move in a nice plane, and the arm of your shoulder will help that move. And this is just basically to allow you all to see that all of these structures here that are in front of you, if you've injured either of those when you've fallen, then it is going to have an impact on how your shoulder moves. So here, just going to in a bit more detail then. So the picture there on the left-hand side is the rotator cuff muscle, consisting of 4 muscles: the subscapularis, supraspinatus, infraspinatus, and teres minor. And they help and assist your shoulder moving in all directions that you can think of. And then the muscle that you've got there on the right-hand side, now it's kind of a forgotten muscle. You may have heard of it, called the boxer's muscle. Now that's the serratus anterior. Now what that muscle does is really nicely hook your shoulder blade in, so it stops it kind of flapping around in the wind and putting you at risk of further injury. So those 2 muscle groups there are the ones that we really want to focus on. We want to strengthen and stabilize the rotator cuff and the shoulder complex. We want to stabilize the glenohumeral joint, and that's just that ball and socket, or that cup and sauce that I mentioned. And we also want to work on a couple of things called proprioception and neuromuscular control. Now, what proprioception is your body knowing where your limb is in space. So if you are about to fall, or if there's a risk to injury, your body automatically knows where your limb is, so it can put it back in. It can try and protect you from a serious injury, and hopefully prevent injury, or if you are going to get injured, make it a smaller injury than what it possibly could have been in the first place. Now, these are just a selection of exercises that I would suggest people complete for prehabilitation, so for strengthening and stability before they do go away. Some of these might be performed in mid-stage rehab after injury, but primarily these are ones that I would suggest in the first instance. So you've just got a couple here that are helping control the muscles around your shoulder blades, really. And what's really important, if you do want to perform any of these exercises, obviously please ask us and we can give you some more advice. But what's really important here is to focus on where your shoulder blades are on your back. So not squeezing them back really tight and not just letting them flop. It's just having them set back just a touch, back and down, before you perform any of these exercises. Now, there are lots and lots of studies out there that all suggest that exercise therapy is successful in rehab and treatment of any cuff-related issues. And there was a study out just a couple of days ago, actually, that suggested whether it's a small tear, a medium tear, or a great massive tear of a rotator cuff, that this is the way forward. Now, obviously, if physiotherapy isn't having the desired effect and the process is a little bit slower than what you would have liked, then obviously we do have the great connection here with the consultants at Schoen that we can refer you across to. So there's a very strong two-way pathway here for you guys. So supports, again, everyone's mentioned DJO and Donjoy, and here are a couple. Now, the only reason really I'm primarily promoting supports for this kind of thing is to make sure that you're safe when you're skiing. Now, this doesn't bulletproof your shoulder by any stretch of the imagination. However, if you have a history of shoulder injury, you've got a bit of an unstable shoulder, then this would be something that I would potentially mention. A dangerous skier, in my opinion, is a nervous skier and a skier that's very apprehensive about going on the slopes. Even if you've skied for many, many years, if you're a little bit worried about something, that's going to be in your head when you're skiing, when you're snowboarding. So if you can get hold of something like this, just to give you a bit of a hug whilst you're starting off, whilst you're on the slopes, then you're more likely to be that safer skier or safer snowboarder or safer on the ice, whatever you're doing. So my top tip, sorry, I've kind of spun all the way through that one there, is to stabilize and strengthen your shoulders. Again, if you do want any more advice or help on those exercises, then please do get in touch. It's to grip your ski poles correctly to try and eliminate the risk of skier's thumb. when in doubt, to seek help from physiotherapists and consultants alike, and we do have that very good partnership. And also, Ultra Sports Clinic offer a free 15-minute assessment to anybody for anything, whether it's advice on exercises before you ski, before you take part in any sports, whether it's the fact you have a niggling injury that's gone on for ages, or you just wanted to come in for a quick body MOT. Please remember, we are there. We have 3 different sites. Please give us a call, drop any one of us an email, and we'll be more than happy to help. And I just thought I'd finish. Oh, look, I skipped too far forward now. I did have a nice picture of a bulldog, because that's my favourite dog, but it's been taken out. Anyway, Ed, back over to you.
That was really great. What a great way to finish. Well, I say finish, but we do have the Q&A to go through. So I will leave, I hope, some contact details on the last slide. So I'll leave those up whilst we go through the questions. I suppose I'm just going to direct lower limb inquiries to Mr. Sweetenham and Debbie, and if you both fancy a go, by all means. So I'll kind of work my way through. So the first is from Simon, who has a tear in his ACL, grade 1, he thinks, from playing football a few years ago. Is he more likely to get injured?
So it all comes down to some extent of what that really means, grade 1. I must confess, I'm sort of the view that you either have a meaningful tear or you don't. I think the likelihood is if it's been functional and you've been back to sporting activity, then no, you're not at any greater risk. I'd be very careful just to make sure that you actually have a functioning cruciate. I think it's a bit ambiguous, that diagnosis. And I you know, from Simon's point of view, I want to know, you know, has he had episodes of instability? If he hasn't, and his muscles are good, then frankly, I wouldn't worry about it. You know, I just get on with things. It wouldn't be a concern. I don't know what you'd say about that, Debbie.
Yeah, I agree actually, David. I agree. It depends on a few factors really, in terms of, you know, your level of function and what you want to get back to, and performance and fitness and stability, all these things. So yeah, I agree, David, for sure.
Perfect. So this question comes in 2 parts. We've got one in the middle, but I'll bunch them together. Is snowboarding less prone to injury on your legs compared to skiing?
Yeah, the facts are quite clear on that. The answer is yes. Snowboarders injure on the upper limbs, and traditional skiers injure their lower limbs in proportion. That's very well established. You know, it's and I think, I can't remember, I was a bit surprised, I seem to remember thinking it was contrary to what I thought, that snowboarders don't injure themselves more often, but I may be wrong on that. You know, so snowboarders get a rather bad press, but I'm not sure about the overall statistics.
I don't know if there's anything to add to that, Debbie.
Say, not really. No, I'm kind of just agreeing with everything you're saying here, really, David. But
I'll let you go first next time. So, right. So this is from Richard, and I'll ask Debbie then. Does the medial meniscus fall under those of the common injuries seen skiing?
Yeah.
Yeah, really good question. It does come into play, as well as the other sort of, well, I guess, common structure in the inside of the knee as well, being in the medial collateral ligament. But in terms of the most common, the ACL kind of trumps those structures as well, really. But it still can be involved in terms of the fall, the mechanism, you know, the position. It can still be involved greatly. In terms of a skiing injury. Does that kind of answer the question?
I think so. Is it something that you see in your practice, David?
Yeah, as Debbie says rightly, I mean, it's part of a picture, a very severe, it's called the terrible triad, which is involved into the medial collateral ligament, the ACL, and the medial meniscus. And that's a really nasty injury where the whole lot goes. It's not an injury I normally associate with skiing. No, I think the medial meniscus or these cartilages in general get torn for all sorts of reasons. But skiing is, skiing, unlike football, that is a classic, isn't an injury that and it's not an injury I normally associate. It's much more sprainy, strainy skiing than the meniscal injuries.
Great, thank you. There is at least one upper limb question, so don't worry. Yeah, Glenn and Adrian, you'll have your time to shine. I'm not sure because this follows from the medial meniscus question, so I assume it's on the same subject. Would rehab after injury be hamstring or quadricep focused, or both?
Yeah, I mean, both they're just important as each other. But I guess if we're thinking about the ACL in particular and these initial stages of rehab, and what can be inhibited is a lot of fear and pain in terms of trying to get restore that knee extension, you know, and quads is the quadriceps is the main sort of driver of that, really. So it's with a focus on both, but I would say with a heavy focus on trying to restore that normal function, that knee extension, and getting the quadriceps going.
Amazing, thanks. Okay, so we'll go to the shoulder question. Hello, I've been told I have shoulder impingement. I'm going skiing next month, and I'm wondering if there's anything I can do to stop this flaring up. Should we start with you, Adrian?
Sure. So shoulder impingement has to do with, in layman's terms, pinching of your rotator cuff tendons, which tends to happen when you're trying to lift your arm up, and happens at shoulder level or above. So that's where your symptoms happen. More commonly, it's actually mostly to do with the positioning of your, what we call shoulder girdle. So it's the way you're holding your shoulders in position. It's not quite perfect. So it's decreasing the space where these tendons lay, and they get pinched. So what you could do is, Glenn's probably better at answering this because it's more rehab, of improving the posture and positioning of your shoulder blade, which should naturally open up these spaces for you. I'd say it doesn't tend to be a big problem in skiing, because it's only really problematic when you're lifting things up at shoulder level and above. And if you're skiing, your poles are generally below shoulder level. But I guess when you're carrying your kit whilst on the slopes, yes, you may struggle with that. Glenn?
Yeah, I mean, I would pretty much agree. So what we look at really with an impingement is an instability or deficient movement really of a shoulder. So absolutely, some of the exercises that I touched on would be fantastic for that kind of thing. Working on where your shoulder blades are around your thorax when you're moving your arms is something that we would really look into. So, you know, by all means, send us an email afterwards and we can definitely get in contact. But I wouldn't, like Adrian said, I wouldn't necessarily worry about it unless you're planning on falling over loads. Hopefully you shouldn't, your shoulders shouldn't be in those positions, but definitely prehabilitation, strengthening and stabilizing and getting in some of those proprioceptive exercises. So again, knowing your body, knowing where your limbs are in space would be really prime things to focus on before going away, for sure.
Amazing. I've got a question about braces, actually. Is there anything else you recommend for a first-time skier? And also, is there a particular brand, type of brace for wrist or knee that you recommend for wearing whilst skiing? I should add now, before our experts answer, that Donjoy have sponsored the event, and there will be an email going around afterwards with a discount code for the braces that are featured on their online store. But if anyone wants to have a stab at that, I will defer to your expertise.
Well, I mean, I think that just from a knee point of view, Donjoy luckily don't need to plug themselves. They're a market leader and they're very good, solid, very highly thought of braces. And the answer is that can be in a prophylactic sense, i.e. protection. And certainly anyone who's got, you know, a concern or a worry about the ligament stability, then these sort of high quality, either bespoke or off the shelf braces can give you that sense of reassurance you often need. So, you know, something like that would be wholly appropriate, absolutely, for someone, particularly, as I've said, who's maybe had an injury or certainly had a previous, you know, something that affected you felt vulnerable. It just gives you that extra bit of confidence, and so it's a very positive thing.
Great. I think that answers that really. And then, I mean, the last question was, I think, in specific reference to some of the videos shown throughout the presentation. And it's just, are the exercises, or are these exercises useful for snowboarders as well?
I don't know who wants to answer that, but I mean, I guess I can go absolutely. I think Debbie and I, well, all of us on the panel would more than likely agree, yes. Regardless of whether your feet are fixed on one solid plank or you've got two legs going either way, there's still going to be a stamina issue that we need to look at. There's still going to be a stability issue that we need to look at. So absolutely, in terms of lower limb and upper limb, as we've even touched on, snowboarders are more likely to injure their upper limb. So absolutely focus on the shoulder stability. But just because your feet are fixed doesn't mean that you're not going to hurt your knees. I've seen a lot of people falling whilst snowboarding and causing themselves harm. So I would say, yeah, prehab and strengthen and stabilize your entire body before you go skiing. You will have a much better time when you're there.
Absolutely, and exercises are always, you can always modify them, right? There's a huge variety, and we are here, of course, to help modify anything that's needed, but absolutely necessary, the exercises that we went through, for sure.
Yeah, I agree with that. Prehab, conditioning, strengthening will always make sure you have a more stable joint and prevent any injury. Sorry, going back now to the previous question, you asked about splints. I don't think there's a specific splint, but like everyone said, if you're trying to protect the joint or you have a weakness of a joint, there's no harm in doing that. But I feel that wearing a splint that immobilizes your wrist may be helpful preventing, but it may actually cause an injury because it keeps your wrists very stiff. And if you've already got stiff feet because they're stuck on a board and now you have stiff wrists as well, you're probably more prone to having a fall or an injury rather than not. So there's a positive and negative to do with splints. It's actually more to do with being careful and falling down properly rather than on an outstretched hand. Maybe support yourself with your forearm as you fall, distributing your weight more widely rather than just on one point like your wrist, which is more likely to cause an injury to one point only.
Well, I think that brings us to the end of our questions, unless anyone's got a last minute one they want to squeeze in now. And we are running to time, so it's 1 minute to wait. So any more questions? Otherwise, I think we'll end there. But I want to say a huge thank you to our experts. It's been really great listening. It really has. And also to Don Joy. Just a reminder that we will send an email around afterwards. This session's being recorded. I'm not sure where it's going to be saved yet. I'll speak to the team at Ultrasports and we'll find somewhere to put it and include that information in the follow-up email. So I hope you've enjoyed it. Big thank you to our experts and to Don Joy, and hope to see you at the next one. Thank you very much, guys.
Thank you.
Thanks.